Hello, ladies and gentlemen. Today I'm talking about the Oregon Rural Health Transformation Program grant and how you, if you're a rural provider in Oregon, can take advantage and win the funds. I've got my little sticker here from the Oregon Rural Health Conference, and I went to this back in October 2025 in glorious Bend by the riverside. And Oregon is a really special state when it comes to rural communities. We know that it's a very diverse state as well in terms of geography. You have the Willamette Valley and all the beautiful produce that comes from there, and the beautiful mountains. Yep, up to Portland, you got a big city, and then east you have more rural, often isolated communities. And last month, I had the pleasure of driving through Eastern Oregon between Portland and Spokane and stopping by the Umatilla Reservation. And there's 9 federally recognized tribes in Oregon as well. It's a really great state, and there's a lot of good people in rural communities doing work. But as this rural health transformation funding comes around, I think everyone's asking themselves the question, how can we get this money? I mean, if you look at Alaska, for example, there was 1,800 respondents to their letter of interest, which is kind of step one of the application. Now, it'll be less in Oregon because Oregon's getting less money, but I'm sure there's a little bit of anxiety and uncertainty out there on how organizations who need this funding, particularly critical access hospitals and rural health clinics, can actually get access to it. Well, in this webinar, I'm going to be talking to you about that today. I'm going to be going through the RFP and sharing a little bit of my experience actually contracting with the Oregon Health Authority. So my company, Appichat Limited, has been about since 2019, and in 2024 we won a nurse recruitment contract with Department of Human Services, and we've got on 3 OHA frameworks to provide technical assistance, report writing, and training to health authorities across Oregon. So we've done a lot of work with the government in Oregon and applied to a lot of RFPs like this one. So we're very familiar with Oregon buys and how it all works over there. So I'm going to pull up the RFP that's out in Oregon so we can start talking about this on a really specific level. So here we go, the request for grant proposals for the Catalyst grants in Oregon. There's 34 pages of this RFP, and I'm going to go through the most important ones for you to take a look at. So Oregon is going to get $197 million for the first year, which is a lot more than people were expecting. I spoke to one of the leaders at the Office of Rural Health, and he said he was not optimistic that Oregon would be getting a proportional amount because of politics and the left-leaning legislature, which in the state, being unfavorably viewed by the feds. However, it's quite close to that $200 million average amount. So good news for Oregon. If you're one of those 9 tribes I mentioned, there will be a specific initiative for you, and the state will be in contact with you directly. And I'm sure that you're already involved with that if you're at a leadership level, and if you're not, if you're working for one of those tribes, maybe you can contact the leader of the health clinic at the tribe or the executive director and find out what's going on, because they're all having one-to-one discussions. That's not to say that tribes are not eligible for this Catalyst grant that is coming through. So the Catalyst grant is aimed to really fund projects that are ready to go, shovel ready, oven ready. You take the chicken out of the oven and it's ready to eat. They want to fund things because year one is so compressed that can get results, show proof of concept, and show success quickly. and justify to the federal government that Oregon should keep getting at least 197 million, if not more money, over the next few years. So how much is it for? And what's the total pot? It's $160 million, and the budget period one is $80 million. So this RFP is going to be distributing $80 million, and you need to understand that. You need to understand that that's the total grant pot here. And when it comes to the limits per organizations, you may request a maximum of $5 million. So it can't be less than $200,000. And you see here they've broken it down, stating that a maximum of 80 awards will be available. So think of it like this. There's going to be a max of 80 rewards, and up to 30 awards are between $200,000 and $500,000. You can propose up to 3 projects, and they all have to be a minimum of $200,000. So my first tip is to really understand the boxes that you have to fit into. Because if you propose for $6 million, they're going to look at that and think they haven't read the RFP because it's a $5 million minimum. Equally, if you propose for $150,000, they're going to question that. Also, think about scope here. You don't want to try and fund something that is really a $100,000 project and you're just trying to beef it up to get that $200,000. It's better to consider what is that $200,000 plus challenge that you can solve in your organization. So being aligned with the scope of the RFP is very important. Moreover, you can see here that up to 30 projects between 200 and 499 are open. So that means I would say 50 projects are open, which are probably going to be greater than $1 million. So if you think that 30,000 goes on an average of 325, so maybe you're talking like 10 million across those 30, the remaining 50 are going to have 70 million to play with. So you can see here that they're not going after small micro procurements here. When it comes to the program, I did a webinar on this the other day, and you have to recognize that there are limits for you as an organization where I think, now don't quote me on this, you have to, it slipped my mind, but I think if it's a $350,000 award from the state to you or above, you have to do an open procurement whereby, like what OHA are doing now, you launch an RFP and people can apply to that. And it has to be a public and open process that follows federal procurement guidelines. So if you're in that $1 million plus, it doesn't necessarily mean you have to do that unless you're contracting out something which is over the limit, which I think is 250,000. So bear that in mind as well whenever you decide what to go for. Strategically, we're looking at up to 30 between this limit and then maybe 50 that are going to be between $500,000 and $5 million. Question is, what are you going to propose for? The good thing is you have a maximum of 3 project slots. So I would recommend that you try and hit both categories. So you have one project which is in this category between 30 and, well, between 200,000 and $500,000. And then you have one which is over $500,000 and fits into this category. And then you have your wild card, which could be in either. If you're a smaller organization and you're wondering, well, $500,000, it's a little bit much for us. We're really working with a budget of $1 million a year or less. I don't encourage you to shy away from this opportunity. This isn't going to come around in rural healthcare. I was going to say again, but it'll be around next year for the following 4 years. But you know what I mean? This program, after the 5 years is done, it's unlikely that such a big cash injection will be put into rural health in these forms of grants, which are open to people like you. So, one thing I've seen people doing is applying in coalition. So, let's say you are a provider agency looking after individuals with intellectual development disabilities in their homes, and you serve two communities. Are there other provider agencies that each serve two communities? Say there's 6 or 7 of them, that together you could make a joint proposal and you're serving 18 communities, and it shows to the state that you're really prioritizing the values of this program, one of which is partnerships. They want to make rural healthcare more connected, more interconnected, and more open to like collaborations across entities and sharing information. So if you're a smaller entity, bear that in mind. And even if you're a bigger entity, you're going to want to show who you will be collaborating with. So consider that too, that you don't just apply solo, but engage some of the other organizations, healthcare providers in your community, maybe even some of the vendors that you want to work with to demonstrate that you thought about this, you understand the values, but most importantly, you're ready to go whenever they fund your award. Because remember, this is called the Catalyst Award, and they want things to get out there quickly, and you need to show that you can do that. Referring back to the RFP, the timeline goes whereby they need to obligate the funds by the 30th of October, which is this the state stating who's going to get the money, and then you need to spend that by the 30th of September next year. Another point for engaging vendors, we're partnering with 5 organizations in their applications, and they were able to say, this is our program. We've lined up this vendor, RHT experts to do the communications and the recruitment pieces and project management. This proves we're ready to go. We just need to sign a contract with them. And if we get the award, we have all the capacity and they can bring in the capacity that is lacking as well. And the important thing here is that you show that you'll be able to spend the money by the 30th of September. Because if that money isn't spent, that's going to be on the state, really, in terms of CMS looking at them and asking for that money back and maybe even granting less money in next year. And then it's going to be on you for your chances of winning funds in year 2 to 5. If you can only spend 90% of the money, you have to hand it back. It's going to make you a less attractive partner or grantee for the succeeding years if you aren't able to carry through all the spend. Jumping over to the eligibility, be sure that you're one of these organizations. They've made it really clear that consultants or consultant organizations can't apply, tech vendors too. That's why an organization like mine, which would be a vendor, isn't applying to this. We're seeking to partner with organizations like this to help them with the communications and the recruitment that's involved in their program. That's another thing that you should be aware of. How are you going to prove and demonstrate and plan so that your program is engaging the public that it's meant to engage? So it's all well and good constructing an initiative. Let's say you're launching telehealth, you're buying the computers, you're training the staff, you're ensuring you have the broadband and the internet. But how are you getting communities to engage with that telehealth? A study in Colorado showed by Connected Nation in 2024 that over 50% of rural residents in northwestern Colorado who didn't have access to telehealth wouldn't use it if they had access anyway. That's because there's trust barriers around quality of care over the phone. There's a lack of awareness that you can get care over the phone. A lot of people think it's over computer, and computers are scary, particularly for older people. And also, there's worries about data security and that kind of thing. So it's not as simple as responding to one of these categories and then getting the money and you snap your fingers and you get the result. You need to ensure that whatever you're putting out has a clear plan to engage your public and get people accessing that service and taking advantage of the increased access to care so that you can generate revenue or cut costs or just make it work overall and get the money in the second year. A few tidbits of information that you need to be aware of whenever it comes to the categories that they want to fill in terms of maternal health, behavioral health, aging in place, chronic disease. These are negotiables really. You have to serve at least one of these populations, and you must begin activities within 2 months. You must spend by September 30th, and outcomes must show progress. So it's not optional to start within 2 months. You have to do it, and you have to serve one of these populations. So whenever you write your proposal, really show, like in the first line, this initiative will improve access and outcomes within maternal health care, and here's how. So make it really clear what you're doing. I found that AI is very helpful with taking an RFP like this and summarizing what the scoring criteria is, what the non-negotiables are, and to get you kickstarted on writing an application. I don't really recommend it for the strategy part in terms of how are we going to be most responsive and win this. And it shouldn't really be giving you all your ideas. You should come up with the idea and get opinions on it. But it is very good for the compliance part, which is making sure that you've ticked all the necessary boxes in your application. So you can download this PDF and put it in the Copilot or ChatGPT and ask it, what do we need to be qualified for? Here are some of our ideas, and it can help you through this. The most important thing, I think, is don't get ruled out in terms of the qualifying criteria. So make sure you're an eligible organization, make sure that you are proposing something which meets one of the population focuses, is ready to go, and then you can do the other stuff, which is being responsive and writing a winning proposal. So what is going to make a winning proposal and what's going to make a losing proposal? Well, as I said, I have seen in other states that the winners from this are generally coalitions or larger facilities that act as kind of a hub for their community. So be that a critical access hospital or a group of rural health clinics or a college health center and a training center. It isn't looking to me very apparent that a lot of smaller procurements are coming out from these grants just across the country because of the speedy rollout and the limitations that CMS have put on all this. If you think of it this way, Oregon really wants that 70 to 80 awards to track, because if they had 200 awards, which would be an average award value of 400,000, which is perfectly reasonable, they're going to have what, triple or 2.5 times the team size, and it's going to be a greater burden on them and their administrative fees caps. Anyway, all this to say, you really need to prioritize the partnerships here. Bring people into your proposal. Don't just go yourself, but if you're a hospital, get the local home health agency, long-term care facility, anyone who's involved in the community healthcare, the preventative side of it in terms of nutrition, exercise, and make them be part of your proposal. Of course, they can do their own proposals too, but the winners here will be those that have thought constructively about building teams, not just going in alone. Also, responsiveness is very important again, whereby you read and understand the initiatives that you're going for, and preferably you can do some of the activities which they have suggested, and you're not asking for money for things which aren't fundable. So sharing the screen here on workforce capacity and resilience, you can see here that they have specified what outcomes they want. So whatever you're writing, it really needs to be tied to said outcomes. The targets are possible, but need to take this format where you can define them clearly. You have metrics tied to them, and they're trackable by the state. Because think of it like this: the state needs to report back to CMS. They need to show that results are being achieved, so you need to show the state that results are being achieved. They have, I think, this mindset of wanting to increase access and do all the good stuff, but at the same time being compliant, not getting on the wrong side of CMS is very important to them too, because these funds are at risk from 2 to 5 years after year one here. So the easier you can make it for them to track results, report them back, and get results, it's going to improve your outcomes. I don't think that you need to achieve all the outcomes, but you need to hit on at least two, I think, for each section. Here's examples of projects as well you can pick up on and kind of align what you're doing to that. Even if it's just in the wording, you align what you're doing to it. So I do hope you find this helpful. This is going to be one of the last in my series on the Rural Health Transformation Program as we see states start to award RFPs, and I see our role as being open if anyone who's won funds needs help with communicating their program and engaging people and actually getting participants into their initiatives. And for those who haven't won funds in this year, do not worry. There's years 3 to 5 after. So I know that rural healthcare is cash strapped right now, and I emphasize with that. It's important to not let go of this if you don't get awarded. Most proposers are not going to get awarded, but you can go to the ones that are awarded. I'm sure that list is going to be public, and let them know what you do if they're in your area and see if there's scope for collaboration. I know I'm ending on a note of like if you lose, but if you lose, it's not over, and I want you to remember that. So thanks so much for watching. If you have any questions or you need any advice about this, ask me. We are on the vendor spreadsheet. If you go on that, there's hundreds of people on that. But if you look up ApplyChat or Nurse Recruitment Experts, you'll see my company. As I've mentioned, we are on 3 frameworks of the Oregon Health Authority already for training, technical assistance, etc. So we know how they work, and we'll be able to help talk you through your application. Thank you so much for watching, and wishing you all the best with your rural health transformation initiatives.